Well, good morning. Like she said, I'm Erin. I'm a physical therapist here at Mercy, working mainly in the outpatient setting between Mercy Hospital and our satellite clinic in North Liberty. So hopefully what we're talking about this morning reaches you guys in a kind of a personal way, whether you've had an injury or you can take this information with you in case you have an issue in the future. So first of all, I want to kind of get an idea, have any of you guys ever had physical therapy? Okay, got a couple. Unfortunately, sometimes it's a common thing that if the injury is significant enough, you do have to have physical therapy, but hopefully it's an enjoyment to you that you can get back to your functional activity once you're done with it. So some of the stuff we'll talk about today, you guys have probably heard then. Some of the stretches we'll go over kind of as a preventative way. If any of you are avid mall walkers when it's winter, it's always good to have a couple things in mind before you really get started with that. So the first thing we're going to go talk about is prevention. Obviously, a good pair of walking shoes is best if you're going to be a walker. Also, you want to do a warm-up and a cool-down. You don't want to just go all out, but you want to gradually warm up. You want to get that heart warmed up as well as all the muscles. And we'll go over some stretches here in a little bit. But the main thing, if you do have an injury, let's say you sprain an ankle or you hurt your knee, you've probably heard of RICE, and it stands for rest, ice, compress, and elevate. And so those are four main things that we want to think about today as we go through this. If you do have an injury, you want to rest it. And if it feels better with rest, then you want to continue resting until you can get back into your activity. After you have an acute injury or an injury that has just happened, you want to ice. And the reason that is because you want to go ahead and you want to contract all the blood vessels so that they are smaller, because after an injury, everything rushes to that site to try to figure out what's going on. And so we want to limit the amount of fluid and irritants that can get to that area. So ice is always best after an initial injury. The next thing is compression, using either like an ACE wrap if it's an ankle, or if it's a knee and it's starting to swell, you can use an ACE wrap to kind of compress it. Things feel better when we have compression over them. And then elevate, this is especially true of an ankle injury. You want to get it up above the level of the heart, and that's just so that swelling doesn't have a chance to sit there and pool. You know, if you've had an ankle injury and you have your foot down, what does it do? It tends to swell. But if you can get that up above the level of the heart, put it on an ottoman or something to get that fluid to get out of there and not just sit right there in the area that's injured. So RICE is a good way to remember after you've had an injury, kind of how the next steps to take. Now some things, so you wonder, is my injury, is it significant enough where I need to go see a doctor? Do I need physical therapy, or can I kind of do things on my own initially to see if it'll get better? Some major things that we need to look at to know, is this serious, is if you have loss of motion. So let's say you hurt your shoulder or your knee or your ankle, and you just, you go to reach for that plate on the top shelf and you're doing this because you don't have the motion, or maybe you don't have the strength. Loss of motion and loss of strength are two things that we want to start thinking, okay, maybe this is serious enough that I need to have it looked at versus just resting it. If it's pain that doesn't get better with rest, if we are up walking and our knees hurt, but when we sit down they feel better, that's a sign that maybe it's just activity that's hurting you, but it's not a severe injury. But if you go to lay down at night and that pain is just persistent and it's really bothering you at rest when you don't have any weight on it or anything like that, then that's another sign that maybe this is a little bit more serious than something that you can handle on your own. If it's uncontrolled swelling, a typical ankle sprain will bring a little bit of pain with it as well as swelling. But if you would twist your knee or something like that and have a large amount of swelling, the more that swelling sits in that joint, the more irritated that joint's going to become. And with irritation, we sometimes see the loss of strength or motion. So a lot of swelling is something that you want to be aware of too. If it disturbs how you walk, if you notice, man, I'm really limping a lot of times those limps, if we do them for a long period of time, can now lead to hip pain, back pain, neck pain. It's all related. It's a chain of events from the ankle on up to the neck and down. So you have to be aware if it's a lower extremity injury and you're really limping, that's something to look at as far as having it looked at, or use an assistive device like a cane, a crutch, a walker, but usually it's best to have it looked at if you need to have some kind of aid like that. And then lastly, if your function is limited, if you aren't able to do those things like squat or kneel or reach up to the top cupboard or twist to open a door, or reach, if you're having to reach across to pull the door shut in the car because you can't reach it with the other arm. Those are all things to really take seriously, because it doesn't take much. Or going up and down the steps. Well, I try to avoid the steps and I take the elevator. But really, if you would just take care of the injury, you could get back to doing those functional things. So look at how you're functioning. Are you trying to avoid certain activities that you'd normally do because the pain is so severe, or you're not able to have the motion? We talked about a good warm-up. Your warm-up should be about 5 minutes at least, so that you're gradually getting your heart rate up, you're gradually warming those muscles up. Even doing a couple stretches up against the wall, and we'll go over these later on. Whenever you're doing activity, it should always be pain-free. I always like to tell my patients that pain is a sign that's saying something is wrong or you're doing too much. That no pain, no gain, that's kind of a false nomer. We don't want to always, push through the pain, because pain is our body's way of telling us we're pushing it too hard or something's wrong. And so, keep that in mind. No pain, no gain isn't always a good thing. Walking, I know a lot of you guys are walkers. One thing we want to be aware of as we're walking is a lot of times we get so focused on where we're going, we've got our head down, our arms pumping, and that's all good because you're probably working really hard. But posture is something that I see a lot of with my patients. Is a lot of injuries come from poor posture. And if you've got your head down and you're walking, what am I doing? I've got kind of my shoulders are rounded, my chin is tucked. What you want to do as you're walking is try to bring those shoulder blades kind of back in together. So you're kind of squeezing your shoulder blades. That chin should be up. You should kind of be scanning the horizon, seeing what's ahead of you. As we get older, we naturally want to look down at the floor to make sure we're not tripping on something or we're picking our feet up. So really try to combat that and try to prevent it. So bring those shoulders back, look up in front. I think you'll feel a lot better. Anytime we bring our shoulders forward, there's a lot of different ligaments, tendons that run across the front of the shoulder that tend to get kind of pinched. You've heard of Impingement Syndrome maybe? And that's when the shoulder doesn't work as well, because we've kind of got that forward head rounded shoulders and everything tends to get pinched in there. So really think a lot of injuries can be prevented with just good posture. When you're sitting at a desk working on a computer or sitting reading a paper, if you've got your arms stretched out in front of you, that can really be hard on your shoulders and you tend to kind of have your face forward. Bring your arms so that they're kind of at a 90-degree angle. Keep that paper close to you. Keep that computer workstation close to you so you're not tempted to be kind of out in front of you. So bring everything closer to you. A lot of times we do everything in front of us. You rarely see someone typing behind their back, doing dishes behind their back. Everything's in front of us, and that just encourages us to kind of fold in and posture. So really try to be aware. Try to open up those chest muscles, bring those shoulders back, and then try to squeeze those shoulder blades together. Even when you're doing daily activities or out walking, and you'll notice you just feel a little bit better when you're standing up taller. Let's see. I think what we'll focus on next is the handout that I've given you guys. I tried to pick kind of the 4 most common injuries that we see with walkers or just people in general that are are active. The first one is IT band syndrome. You've heard of maybe the IT band. It runs from the hip down to the knee. It starts out as a muscle and turns into a fibrous band. And a lot of times it's tight in walkers, cyclists, runners. It tends to be a common area of pain. And it can often just be tight because of the way your feet are positioned. Everything's connected from the foot to the cervical spine and back down. And so if your feet, if they roll in too much or they roll out too much, if they're not properly positioned, that goes all the way up the chain and can really affect how tight the hip and the IT band is. So, and we can talk more about that on an individual basis if any of you guys have issues. The IT band goes right over the, you have what's called a bursa, which is a fluid-filled sac that acts as a kind of a cushion to the tendon, so it's not rubbing directly over the bone. And that sometimes, if you have kind of that, it can kind of be described as a deep burning sensation. It's right over the greater trochanter, what we think of as the most bony part of our hip. That sometimes can be irritated by the IT band, and we call it bursitis. And that responds usually pretty well to either ice or heat, depending on if it's a new injury, we want to go the route of ice. Some people find that heat relieves, and that's something to keep in mind with all injuries, is if it's not a new injury, you're probably fine to test the waters and try heat and try ice both and see which one you respond best to. There's really no hard and fast rule for injuries. Unless it's an acute or it just happened injury, then you want to do ice. But if it's something that's been bothering you for a while, test it out and see if either ice or heat feel okay. We'll move on to plantar fasciitis. How many of you guys have heard this term? It's a common one, and unfortunately, a lot of people have it and maybe just don't get it treated, but it usually is one that can be treated pretty well with some stretches and use of either, most likely ice feels best for this, but the most common symptom is people say, I have pain when I first get out of bed in the morning. Those first couple steps are brutal. You know, I just feel like I can't put any weight on my feet. But then once I start walking, things start to feel a little bit better. That's because the plantar fascia is a fibrous band that runs from your heel up to the edge of your toes. And over the process of the evening, when you're sleeping, that tissue tends to get tight. And so when you step down first thing in the morning, you're stretching that tissue. And so that's why you have pain with those first few steps. Once you've taken a couple steps, it tends to stretch out, and that's why you feel a little bit better. It can also be because of the position of your foot. So a lot of these injuries you'll see all relate to the position of the feet. And sometimes you can get a heel cup that will help because a lot of people complain about the heel hurting. That's where the plantar fascia begins, is at the heel. And so oftentimes a heel cup will just be enough of a cushion that you won't have that issue. You may have seen some kind of off-the-shelf or over-the-counter night splints that they have out there at different pharmacies. Those can sometimes help. It just depends on the person. But really, some of the stretches we'll go over are kind of the best tools to have out there. The next thing on your list is degenerative joint disease, DJD, or also known as osteoarthritis. It's most commonly found in the hips, knees, and ankles. A lot of people that have osteoarthritis will try physical therapy out first. The physician will send you to physical therapy. Try that route first, and then if it's something that just isn't getting better, or loss of joint space, so there's not as much cartilage between the two bones, then they may look at something more like a joint replacement or a partial joint replacement. But usually a good set of stretches and strengthening can really help with the osteoarthritis as well. And then finally, the low back pain. Any of you guys have a history of low back pain? It tends to kind of be the common thing, unfortunately. Again, we're going to hit on posture. The more that you spend time in a stooped position or in a kind of a prolonged position, the more of a chance you have of injuring your back. Anything like snow removal, how many of us scoop snow? Unfortunately, we're in Iowa, we have no choice sometimes, but all about the posture as you're scooping snow. So don't just try to get through it, scoop, and throw it over your shoulder, because you're going to put yourself at risk for a shoulder injury as well as a back, but really be aware of your posture and how long are you stooping for? Are you taking a break? Are you trying to get your shoulders back kind of in that upright posture, or you just kind of head down, focus on the snow, just trying to get it done. Housework, if you're doing a lot of stooping or bending forward, that over time can lead to some back pain. Heavy lifting, if you're not using your legs but rather just trying to use your trunk or your shoulders, that can lead to some injuries. With back pain, there's a variety of reasons why we may have back pain. It may be that you have arthritis in the joints of the back. It may be that you have a disc that's herniated or pushing out and irritating a nerve. Or it could just be postural, that those muscles on the back are overstretched and the ones on the front are too tight, and that can make you have more of the stooped posture. And we'll go over those again on an individual basis, but a lot of times you hear the term sciatica, and that is basically irritation of the sciatic nerve, and that can sometimes be misdiagnosed by a person just as, oh, I must have pulled my hamstring or done something because I have pain in the back of my thigh. And a lot of times we trace it back and it's actually coming from the back and it's not a hamstring injury. So that kind of can be a tricky one as it presents with the back of the thigh pain. So those are the 4 that we talked about. I'm just going to go over the packet that I gave you for some of the stretches. So if you'll see on that first page, this is for plantar fasciitis, some common stretches, and we'll just go over a couple. One of the best ones we can do is the gastroc stretch in the upper left-hand corner, and that's finding a wall, and this is a great one to do before you walk. So what you're going to do, I'm trying to think, is it best to go over here? Is that okay? So you're going to bring one foot back behind the leg that you're stretching. You're going to keep this knee straight, and the knee in front is going to bend, and you're going to push into the wall until you feel that stretch in the leg in the back, the one that's straight. You want to make sure your heel stays down, because if you pull it up, then you don't get as much of a stretch. So foot's flat, legs straight, and you're just going to push into the wall until you feel that stretch in your calf muscle. And then if you look at the bottom left-hand corner, that's another way to stretch. I didn't bring a towel, but I do have a scarf. So what you're going to do is you're just going to loop a towel or a sheet or a belt around your foot, and you're going to pull up until you feel that stretch in your calf muscle. This is another good one, maybe a better one to do at home where you don't have to take your shoes off before you're out at the mall walking. You see in the middle row on the right-hand corner, it looks like someone's stepping off of a stair step, and that's a good one if you kind of bring your toes to the very edge, and always do this on the bottom step so that you're safe. You're not doing it at the top where you might roll down the steps. And you can just drop your heel down so that you feel that stretch kind of in the middle of the foot. That's a good one. See, the second page is more for that IT band syndrome that we talked about. You can see in the upper left-hand corner that person has one leg back behind and they're leaning away. That's so that you'll feel a stretch in the hip and kind of down towards the knee. The Piriformis Stretch, just crossing your leg over and then doing a little bit of rotation. You'll feel that kind of deep in the buttock muscle. The hip flexor, again, these are more ones that you'd maybe want to do at home rather than here at the mall or wherever you may be walking. But dropping down on one knee and leaning forward. If you're going to be kneeling though, make sure you have a pillow or something under your knee. You really don't want to directly be putting weight through your knee without some kind of cushion. And then on the bottom lower right hand corner is a really good hamstring stretch. I'm going to come around to the front. So you can use a chair, an ottoman, and this also works on balance. So have something to hold on to. You're going to put your foot up on the chair, keeping your knees straight, standing up tall. You'll feel that stretch in the back of the thigh. If you bring your toes up a little bit more, you'll feel it as well into the calf, and you can lean forward as much as you need to give more of an intense stretch. But most people can feel it just by standing upright. So again, always have something to hold on to if you're going to be doing that one. Let's go to the third page, which is more for the knee osteoarthritis. Those first two at the top are working on the bending of the knee. A lot of times we'll see a decrease in the bending motion as well as the straightening motion. So we're just trying to get the knee to move a little bit better. The straight leg raise, which is the middle row on the left-hand side, is a great one to try to strengthen the quadriceps. And only lifting it high enough that you can still control it without using momentum. A lot of people will swing the leg up. It's not as how high you can get it, but it's how controlled you can get it, tightening the muscle on the top of the thigh. And then even a simple one, if you're sitting in a chair at home, you can do a really simple exercise to kind of warm the knee up. And that is just kicking your leg out straight and then slowly back down. So nice and slow, you're working on the control of the knee. And that picture is not on there, but that's a great one to work on. And then on the last page is more for that low back. And again, depending on what the injury is, and low back pain persists, it's probably best to have it checked out. But some people prefer being in the flexed or forward position. Their back hurts, but it feels better when they're like this. Some people it feels better to stand up, and that's just depending on what's going on. If it's a disc, the more you bend forward, the more it pushes back, so it hurts you. So we want to try to get you more into that extended position. So I didn't really touch on that, but I just gave some really good general way to warm up your back versus really if you have an injury. Sitting in a chair like that top middle one, reaching down towards your toes until you feel a stretch in your low back. Knee to chest, or bringing both knees to your chest. It's a good way. You can do these in bed kind of before you even get up and get started. You see that hamstring stretch again on the far right side using a chair or an ottoman. And then the last one is that pelvic tilt, and that's just a lot of times the back gets injured because our core muscles aren't as strong as we want them. You've heard the kind of core strength, those kind of terms are pretty common these days. And so the pelvic tilt is really just drawing in those abdominal muscles and trying to flatten kind of that low back against the mat or the bed to try to tighten those stomach muscles to help protect the low back. So again, like I said, we can go over individually if you have any specific questions, but I think that's all I have.